Welcome, everybody, to the Health Terminology and Interoperability Standards Certificate Program's online information session. I begin with the territorial acknowledgement that we acknowledge and respect the Lekwungen, that's the Songhis, Esquimalt, and Kasepsen peoples, on whose territory the university stands, and the Lekwungen and Wasanich peoples whose historical relationships with the land continue to this day. My name is Simon Minchell. I'm an assistant teaching professor at the School of Health Information Science within the Faculty of Health of the University of Victoria in British Columbia, Canada. And I welcome you all to our info session. I'm really happy you're here. We're going to talk today about the Standard Certificate Program. We're going to talk about the two streams you can take in order to pass through the program and earn the right to get the CTSS certificate. So let's start with the idea of what is a standard. A standard is an agreed upon way of doing things. And we've had standards for thousands of years. So it's nothing new from that respect. But since computers became part of healthcare, standards increasingly take a more important view. Imagine that you work for a health authority and that you have to speak to many different hospitals. I'm looking on the left-hand side of the diagram here. What if all the hospitals exchange data with you using a different language? You would have to do translations from one language to the other in two directions for each connection you have. And mathematically, the relationships, as they expand, the number of connections also expands geometrically. So what's the solution? The solution is to move towards what's shown on the right-hand side of the diagram, where effectively everybody is speaking the same language. Now, paradoxically, in healthcare, humankind's most complex endeavor ever devised, there is more than one standard. And so I'm showing on the screen here a list of many of them. Simple transport standards, more complicated classification standards, and highly complex terminology standards are all covered here. And together, they all represent that notion of speaking the same language. So if healthcare runs on standardized information, then how do you untangle all of its standards? How do you know which standard to use? How do you even get started implementing something that is complex and large and with many pieces? Well, that's what this course is about. Well, rather I should say this program. The University of Victoria's School of Health Information Science a few years ago created the Health Terminology and Interoperability Standards Program. Why? So that enrollees, students, can become eligible for a professional credential to state that, yes, they have been educated and know about health standards so that you can be more useful in the workplace. Students gain knowledge and skills in the adoption and management of health standards. And these are health standards used at all levels, whether it's the doctor's office or a hospital or a health authority or an international organization. And they learn how to apply it and adopt it and implement the standards so that all of our organizations can really strive to get towards a single interoperable state. Okay. The other reason is students enroll in this program to get involved in research, not only in the standards area from an applied point of view, but also perhaps from the theoretical perspective as well. Students have the ability in one of the final courses to choose a direction and do a final project that it could be research focused or applied. So what does the program look like? Well, it's I should say, first off, welcome everyone, if you've just joined, that the program is designed such that you, if you enroll, can do this program whilst also working full-time. It's a part-time offering. The class meets once a week, and you'll have homework to complete before the next class begins, or perhaps throughout the entire term. Okay, so it takes 1 year to complete it. Typically, it starts in December, September to December term with Hint 535. Hint 535 is Health Information Standards. It's a survey course looking at that big long graph of standards that I showed earlier, including SNOMED, CT, ICD, HL7, FHIR, and all of that. It's a bit of a survey to examine all of the standards available for healthcare. Okay. Yeah, typically as well, to cater to those of you working, which would be most of you, class is held Pacific time at 5 to 7 p.m. So if you're in British Columbia, it's just after work, and if you're eastward in Canada, then it's early evening, so accessible to pretty much everyone across the country. It moves on to the January term. We call it the winter session, and also the spring term, paradoxically, with hint 536. Dennis Lee is on the call right now. Yeah, why not? Do you want to say a few words about 536 since it's coming up for you?
Sure. So the course is over 13 weeks. Well, we do have a reading break, so we have 12 weeks, and we're going to cover a lot of topics. We're going to go into a lot more details than HIM 535. 535, yeah. So for 536, we'll go into a lot more detail. We'll talk about how to develop proposals, how to assess the readiness and feasibilities of terminologies. We talk about change management, and also we go into a lot of details on the terminology content itself, looking at how to do mapping, post coordination, translations, extensions, develop subsets, how to do data retrieval, quality assurance, and then also look at how we implement or adopt it, looking at some of the technical requirements, implementation strategy, education, training, as well as evaluation.
Thanks. And Dr. Lee will focus mostly on SNOMED CT and other terminologies. SNOMED CT, I teach the undergraduate version of HINT 535. We're covering SNOMED CT now, and it is quite awe-inspiring from the point of view of the students, and wonderful in its own way. Now, that wraps up the end of the normal term session. The last two courses are held they're held consecutively in the summer term beginning in April. So from the first part of the summer term, April to May, Dr. Bird teaches HINT 537 on focusing on health information exchange. There is a virtual workshop that happens usually in May for an intensive, it's almost a week-long session. Again, also held, this is outside the normal class structure. So ordinarily classes are held between 5 and 7. So that wraps up in May. And then in the second half of the summer term through June and August, we have HINT 597. This is the capstone course where you take all the information you have learned up to there and engage in a project that hopefully is meaningful to you. We'll cover a few of the potential topics that you might consider in the next couple of slides. So I'll mention just a little bit about the admission requirement. We have two streams. Yeah, so I don't have any slides for this. We have two streams, one covering the graduate stream, where you are expected to have a baccalaureate degree. That's like a BSc in recognized by UVic's Faculty of Grad Studies to get in, or potentially relevant work experience. But the restrictions for the graduate stream are such that the work experience is required to be 15 years in length or more. So to overcome that and to shorten the work experience time, we also have a professional stream in which students do not need a baccalaureate degree and just need a few years of professional experience to engage with the program. So it doesn't matter which stream you get into, it's the same course structure, it's the same instructors, it's the same class, it's the same content. So either stream you're in, this program is the way that you get CHIMA's CTSS certificate, which you can then put on your resume and your business card if you use them. So jumping back to the capstone courses field projects, you might be wondering, well, okay, I'm in this program, but what could I possibly do as a field project that would be of use? There are several examples. I'm going to read out 4 of them. The first is to identify requirements for a specific terminology for health organization use. So say you work at a health organization, such as a hospital, and the hospital is considering implementing a specific standard. What are the requirements for getting that off the ground? How do you even start? And you could look into that as a potential field project. Another example is to dive more deeply into using a particular standard, you might develop specifications for a structured data entry or retrieval template for a form or a survey or a questionnaire. And you'll learn through the program there are many methods of doing that that you could easily dive into and do something a little bit more technical. A third example is to map local drug terms to the Canadian Clinical Drug Database. Mapping is one of the key areas of health information standards. As there are many standards around, and there are many older standards around that may not be used anymore, how do you map from one system to another system? How do you map from a homegrown system that your family doctor has used into standardized coding? How would you do something like that? So any of those kind of areas, if any of that interests you, then that's something you could do as a field project. I would urge you to choose something that is of interest to you, potentially even useful for where you work as well. You'll get more out of it that way. Lastly, you could take a research track and instead focus your efforts on doing a literature review. There are many forms of them, but you could evaluate a terminology's impact on the quality of care, for example. So let's say you didn't have a standard implemented at one point, but you have lots of data there, and you now do have a standard. How has that changed things? And you could explore that in more depth as well. So there's a broad range of things. These are not specific topics for you to pick from. These are just ideas of the sort of things you could end up doing in the third course. Okay, I do have a slide for the HTS2 streams. Just bear in mind there are two separate entry points for this. If you're interested in the professional stream because you meet those requirements, then you could hop over to the UVIC's Division of Division of Continuing Studies and ask there and inquire there, and you'll find out more information than you'll get from this session. Okay. On the other hand, if you are interested in the graduate stream and are also eligible to join it, then you can jump over to, I missed a link there. You can jump over to the Health Information Science site at UVIC's webpage, and you'll get more information there, including extra videos. There's a recording of a similar talk there as well. Okay, two separate entry points, pretty much the same fees for each one. The details are where things differ, but again, both of them will lead you to the CTSS. The CTSS is CHIMA, the Canadian, the page I'm showing here isn't CHIMA, it's the Canadian College of Health Information Management. CHIMA is their sister organization that also deals with accreditation. They issue the CTSS, the Certified Terminology Standards Specialist, and that is the way they issue that is that there is no exam. You don't have to write a professional qualification exam. The only way to get that is to complete our program, and that's for the time being. If another organization comes up, then maybe there'll be two ways of doing it. Okay, and so by graduating from the program, you are then eligible to sign up for the CTSS, and there's a small annual fee to pay for it. CHIMA's site also offers, there's a job board. They have lots of resources, so students are encouraged to join CHIMA at a student rate to gain access to the information that they have. One of the best things about it, perhaps from your point of view, is a job board with situations vacant that are very specifically oriented towards the people who work with health information as a career. So upcoming ones, clinical coding specialist as a health records technician was offered at the Hamilton Health Sciences, for example, and it would show up there. So it's a useful resource. So how would the professional certificate program or the graduate certificate program and the CTSS help your career? Well, it is in demand by employers. We do see some job ads that specify they're looking for the CTSS. We would love to see more of them. You become kind of an important individual within your organization. You're often described as the glue. If you're the person in your team that knows about standards, the moment a standards-based question comes up, you'll be the first person they ask. Okay, I've personally been in that situation, and it's kind of fun. You become the local expert for these things. You'd get to implement standards in health information exchange and electronic health record projects. You could go into business even and work on implementation services. There's lots. There's three recent initiatives in Canada. Canada Health Infoways produced a bunch of standard resources for COVID-19. That happened really quickly and had to be done in a hurry due to the initial sudden onset of COVID-19 in Canada. There was a time before we had no standardized language or codes or descriptions or terminologies for COVID-19. And then a month later, we did. It was quite amazing. And it wouldn't be possible if we didn't have people that knew how to manipulate and work with standards. One of the major projects that's going on in Canada right now is the Pan-Canadian Patient Summary and the specifications for it that are underway. And there's always health information exchange projects, whether it's at the policy level or the implementation level or at the computer science level. Again, somebody with these credentials could be the glue in those organizations. Here's an individual that some of us know. Kelly Davidson passed through the certificate program as an early adopter and currently works as a nurse in Vancouver. And Kelly writes, I was interested in the political economy of electronic health records and terminology standards, how they represent a critical opportunity for us to connect systems across different programs, specialties, and levels of care to unify the patient chart. I mean, that's interoperability in a nutshell, the key application for this kind of information. So we're proud to have Kelly as an associate. So I'm kind of coming to the end of my spiel here. It's supposed to take about 20 minutes, and I think we're bang on time for that. We'll open it up for questions in a few minutes. Until then, where do we go for more information? Really, the web is your first point of contact. It's here, uvic.ca/health/hint/certificates, and you'll find out what you need to know about our certificates. Alternatively, if you're interested in the professional stream, the continuing studies have their own website, and you could look up the word health or terminology, and you'll be directed almost immediately to the right page. Going on there. Deadlines are approaching. We have 2 entry points per year. The first one is just passed in September. The deadline for it was June the 1st, so that's done. The next one is coming up rather quickly in a couple of weeks, actually slightly less than a couple of weeks. The next deadline is October the 1st for the January start. Now, I know I went through the list of courses in order, but it's perfectly fine for you to start Hint 536 in January. And if you apply, if you're interested in this and you want to get started right away, apply as soon as possible for October 1st, the deadline, and we can process the application, and if successful, you can join in January. It's a good time to start. The middle of winter, hunker down, get some of the work done, and have a good time while you're at it. The other way you can get more information is you can contact myself. This is my email address, htscoord@uvic.ca. That'll come to me, and if I need to traffic control you somewhere, I will do so. So please don't hesitate to reach out. All right, information about CHIMA is on there as well. And that's it.